Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Naura Amalia Shaliha from Nursing International Department, and my student number is J2102342006. First of all, I will say thank you to the Lecturer of English Academic Purposes, Mr. Ivan Rifai, and all of my friends that watching my video. And now, I will explain about my presentation with title Nurse Job Description. So, what is nurses? Nurses are professions that you often find when you are in the hospital. The main task of nurses is to provide care to individuals, families, and groups in sickness and health so that they can achieve, maintain, or restore optimal health and quality of life from birth to death. Nursing duties are vital in providing health services to the community. In Law Number 38 of 2014 concerning nursing, there are 6 main duties of nurses as follows. First, providing nursing care. Nursing care is a series of interactions between nurses and patients and their environment to achieve the goal of meeting the patient's needs and independence in caring for himself. Each of the main duties of a nurse is regulated in detail in the law, including providing nursing care, which includes the following. First, carrying out holistic nursing assessments. Second, establish a nursing diagnosis. Third, plan, implement, and evaluate nursing actions. Fourth, make referrals. Fifth, provide action in emergency situations according to competence. Sixth, provide nursing consultations and collaborate with physicians. And the last is carrying out health education and counseling. So, we move to the next duties. Counselor for patients. In carrying out his duties as an instructor and counselor for patients, including first, carrying out holistic nursing assessments at the individual, family, and community group levels. Second, carrying out community empowerment. Third, carrying out advocacy in public health care. And the last is carrying out health education and counseling. Third, nursing service manager. Nurses are also tasked with managing nursing services as follows. First, conducting a fund assessment determines the problem. Second, plan, implement, and evaluate nursing services. And the last is manage cases. Fourth is nursing researcher. In carrying out their duties as nursing researchers, nurses have the following authorities. First is conduct research in accordance with standards and ethics. Second, using resources at health service facilities on behalf of the leadership's permissions. Third is using patients as research subjects is in accordance with professional ethics and statutory provisions. And fifth is executing tasks based on delegation of authority. This can only be given in writing by medical personnel to nurses to carry out appropriate medical actions and evaluate their implementation as follows. First is carrying out medical actions in accordance with their competence based on the delegation of delegated authority of medical personnel. And the second is providing health services in accordance with government programs. And the last duties of nurses is executing duties in certain limited circumstances. Also includes the main duties of nurse. In carrying out their duties, nurses do not have special authority but can take actions according to government assignments, including the following. First, carry out treatment for common illness in conditions where there are no medical personnel. Second, refer patients in accordance with the provisions of the referral system. And the third is carrying out limited pharmaceutical services in conditions where there are no pharmaceutical personnel. Apart from the 6 main duties of nurses above, nurses also have 8 role elements. First is including caregiver, client advocate, counselor, educator, collaborator, coordinator, change agent, and consultant. As you can see, these are the nurses' daily tasks. Reported by Gwyneth Mercy University, the following are the daily duties of a nurse. First, perform a physical examination of the patient, record the patient's detailed healthcare history, listen to patients to analyze their physical and emotional needs, provide consultations and health educations to patients, coordinate with other health services and specialists, stay abreast of advances in healthcare science, medications, and treatment plans, take blood and do medical tests, and the last is check the patient's vital signs. The last slide is about key skills for nurses. First, excellent people skills including the ability to listen. Second is the ability to use initiative and solve problems, attention to detail, the ability to deal with emotionally charged and pressure situations, excellent verbal and written communication skills, and the last is IT skills and the ability to keep patient record up to date. I think enough for my presentation. I hope this presentation will add more knowledge about nursing profession. Thank you for watching my video. Wassalamualaikum warahmatullahi wabarakatuh.